Hello everyone, today we are here to show how we do retrograde massage for edema management. Retrograde massage is a type of massage technique that can help to disperse edema and to encourage blood flow, particularly in the hand. It is a common technique used by occupational therapists to reduce swelling, and the massage consists of manually moving fluid from the tips of the fingers back toward the heart to be reabsorbed into the bloodstream. Retrograde massage is recommended for dependent swelling. This means that the swelling is happening from lack of movement, which traditionally aids in pumping fluid back to the heart. Dependent edema is a term that doctors use to describe gravity-related swelling in the lower body. Gravity has the effect of pulling fluid down toward the earth, causing it to pull in the lowest parts of the body, such as feet, legs, or hands. The purpose of retrograde massage are to stimulate the initial lymphatics to absorb excessive fluid and large molecules from the interstitium and to move this limb centrally, to reduce swelling, aids in venous absorption of the small molecules, and also to increase movement of the extremity due to injury. For indication, this intervention is suitable for acute edema, distal radius fracture with edema, and also subacute swelling after surgery. And for contraindication, it is not suitable if the client has an infection, blood clot or hematoma, a heart condition like congestive heart failure or severe cardiac problems, a pulmonary problems, and also renal failure or severe kidney disease.
Let's move on to the intervention procedure. The equipment needed are lubricant, towel, pillow or cushion, measuring tape, table or armrest. So for the preparation, first the therapist need to check for patient tolerance of the massage to apply the pressure, and the therapist need to wash the hand first as well as ask the client to wash the affected area before starting the massage.
Step of precaution. When applying pressure, we need to make sure the pressure is less than 60 mm Hg to avoid damage to the lymphatic system. Next, stop massaging if the client complains of any pain. And lastly, check for any condition or patient condition before starting the massage. Here are the overview steps of this intervention. First, we will measure the circumferential of arm or area affected with edema using assessment figure of 8. Second, positioning. We position client arm with elbow resting on armrest, towel or cushion. Thirdly, we will elevate the hand above the elbow and heart level. Fourth, we will lather lubricants such as oil throughout the arm. Fifth, we will start massaging with moderate pressure from distal to proximal using milking movement. And lastly, repeat for 5 to 10 minutes of the massaging. And lastly, we will measure back the circumferential of the arm or area affected with edema. Now, moving on, we will take a look at the demonstration video of this intervention.
The first article for evidence-based study is the effectiveness of edema management technique for subacute hand edema, a systematic review. The purpose of the systematic review was to examine the evidence of effectiveness of treatment for subacute hand edema, including retrograde massage. Next article entitled String Wrapping versus Massage for Reducing Digital Volume by Kenneth R. Flowers, 1988. Results show that a significant difference existed between treatments, except between massage and string wrapping. But the two combined techniques were significantly more effective than either the massage or the string wrapping technique alone. Distal radius fracture therapy practice taken by McCovis et al. 2001. This study showed that during the management of distal radius fracture patient, therapists used several different treatment techniques, including retrograde massage, to achieve the primary goals of edema control, increased range of motion, and decreased stiffness.